Hi, I am Dr. Priyesh Patel, medical gastroenterologist, hepatologist and liver transplant physician. And today's video would be a short video about what exactly is endoscopy, who needs to undergo endoscopy, and what are the basic procedures in an endoscopy basically. So what is an endoscope? Basically, endoscope is just a long pipe which has camera on one end and the other end is attached to a source or a monitor, either a computer or any other monitor, so that we can see and take real-time images. And it has obviously a software so that the images are uploaded in a particular fashion. And what kind of endoscopes do you have? So basically endoscopes in whatever organ it goes, it depends on that. So a respiratory medicine or a chest physician will have something called as a bronchoscope, where you'll have a tube with a camera inside which will go inside the lungs and see what exactly is the lungs ka focus. As a gastro practice, what are the endoscopes we have? So we have two basic endoscopes. One is a upper GI endoscope and one is a lower GI endoscope. Upper GI endoscope, simply put, goes from the mouth, food pipe, stomach and up till the upper portion of the small intestines. And what does it rule out? Any acid related problems, any growth or tumor inside, any ulcer inside, any bleeding inside, any patients with liver disease which have bleeding, or any other sort who are having a symptoms of upper GI related symptoms. And we have a lower GI endoscope which is passed through the anal area and which can see the entire length of the colon, right from the anal area to the entire length of the colon, which is also called as a colonoscopy. In upper GI as well as in lower GI, there are channels inside the endoscope. If we want to take biopsy, that is a small sample for looking into the pathology, or if we want to do a therapeutic treatment, let us assume that somebody is bleeding from somewhere, and while we put in endoscope we see the source of bleeding, then we can do therapeutic procedures like applying some medications to the bleeding part or stopping the bleeding via endoscope. So basically these are the in general endoscopes. There are also something called as a side view endoscope or a ERCP, which is used when the stone inside the gallbladder has come out and is stuck inside the passage, causing jaundice and itching and fever. In that terms, we use a ERCP to remove that particular stone so that the jaundice is cleared. Who requires an endoscopy? As I mentioned, depending on what organ you are suspecting a disease, depends on that we suspect that the person, the gentleman or lady in question, would require an endoscopy. So we start with upper GI endoscopy first, the basic and most common endoscope which is probably done left, right and center, where a scope is introduced to the mouth. So anyone who is aged more than 55, even if the age is less than 55, but there are chronic abdominal symptoms which we call as acidity or abdominal pain or recurrent vomiting, anyone with significant involuntary weight loss, somebody having vomiting with blood or black tarry stools, somebody having low hemoglobin, and somebody who is not having any relief in spite of taking adequate measures but the abdominal pain persists, then we recommend to do an endoscope to find out if there is any pathology inside. In the endoscope, while upper GI, we also may do a test for something called as H. pylori testing. So H. pylori is a very common bacteria in our general population, but if you have recurrent symptoms, then we may test for H. pylori, and if the test is positive, then obviously we have to treat it likewise by oral medications itself. Similarly, if a patient is having liver disease, then endoscopy is mandatory during the diagnosis of liver disease to look for any large veins. Similarly, if somebody has vomiting with blood, then endoscopy is compulsory immediately after stabilization, maybe after giving some blood and blood products so that the hemoglobin is maintained, and then doing an endoscopy so that we find out the cause, and until and unless we treat the cause, the medicines will not act. Usually the prerequisites for endoscopy is a fasting stomach, 6 to 8 hours of fasting. In patients with diabetes, we also want a 12-hour fasting, no diabetic medications. Each patient we advise to do a HIV, HbA1c and HCV prior to the endoscopy testing, and can be done either on a local anesthesia or a general anesthesia. Usually local anesthesia is in the form of a spray, where the spray tends to numb down the throat area so that passage of endoscopy is very easy. It is hardly a 2 minutes procedure, both diagnostic as well as therapeutic. Some people who are very young in age or maybe very old and very anxious may require some sort of a sedation which is intravenous. By vein flow, we give some sedation so that they sleep during the procedure, and it can be done that also. The lower GI, who requires a lower GI endoscopy? Somebody again who is having involuntary weight loss, recurrent abdominal pain, who is having low grade fever, suspicion of intestinal tuberculosis, recurrent loose stools or blood in stools, or somebody who is having a family history of a colonic cancer would require a screening colonoscopy or a lower GI endoscopy to rule out any of the pathologies we had mentioned in the last few seconds. And this last would be ERCP. I already mentioned that somebody who is having a stone inside would be requiring a ERCP to clear that passage so that the jaundice comes down. Apart from that, endoscopes can be used in an unconventional manner also to reduce weight. We put in an endoscope and we put in a balloon inside so that the stomach is inflated, and which helps in reducing the weight. There are other procedures for chronic GERD like GERD, or chronic symptoms like dyspepsia or lax LES, why endoscopically we can treat these patients. And apart from that, there are high-end procedures where somebody who is having symptoms of difficulty in swallowing, and if there is a growth or mass inside, an endoscope is also helpful in putting a stent so that the passage is cleared. It can be even used for doing like procedures like POEM so that the achalasia is cleared. But then it, as I mentioned, it depends on what exactly are the symptoms and signs. So this in short is the endoscopy, what exactly we can help you out. And if you have any of the symptoms, you can please contact and we can take it from there whether you require it or not, and we take it in person. Thank you.